Hi, my name is Megan Hernandez, and I'm the Senior Division Director for the Capital Region Division of the American Heart Association. The Million Heart Initiative was actually launched in order to prevent 1 million heart attacks and strokes over the next 5 years.
Hernandez says there's a list of ABCs to keep in mind when trying to maintain heart health.
The ABCs are really simple. A stands for appropriate aspirin therapies as directed by a physician. B stands for blood pressure control. C stands for cholesterol management. And S is for smoking cessation. Everyone should talk with their physician before starting an aspirin regimen. Typically, most normal, healthy adults can be on an aspirin regimen, but they definitely want to talk with their physicians before they start anything. Your blood pressure should be monitored by your physician. It's always great to sit down and have that conversation with your physician about your blood pressure and where your numbers are. At this point in time, typically about 1 in 3 Americans have high blood pressure, and only about half of those people are actually treating it and have it under control. Good blood pressure numbers, the standard 120/80. If you're really a whole lot higher than that, your physician is probably already going to start to have those conversations with you about what you can do to get your blood pressure under control. Typically, your high blood pressure is going to come from being overweight. Typically, your high blood pressure is going to come from poor diet, stress. All of those things contribute to it, but it's very simple to make changes in your lifestyle that will improve your blood pressure. You can certainly control your blood pressure by your diet and exercise, eating lots of fresh fruits and vegetables. Anything that has a label, you really need to read it because you really want to be choosing those foods that have the least amount of sodium and the least amount of saturated fat, trans fats, and cholesterol. Those are all ways to lower your blood pressure. Cholesterol management is so important because cholesterol actually builds up in our arteries and makes it that much harder for blood to flow through them freely. There are what we consider good fats and bad fats. HDL is going to be considered those good fats, while LDL are going to be considered your bad fats. The bad fats build up more quickly and are harder for your body to get rid of, so that's what ends up clogging our arteries. We consider anything between 200 and 240 to be a little bit borderline, and anything over that to be high. And that's the point when you and your physician are going to want to start to have those conversations about what you can do to lower your cholesterol. We find with people who smoke is there's always hardening of the arteries, aside from just introducing chemicals into your body constantly. Those people that don't smoke should obviously never start, and those people that do should quit as quickly as they possibly can because we do see a dramatic increase in lung function, and the body really does bounce back from smoking if you can quit as soon as possible. By controlling all these risk factors for heart disease and stroke, you lessen the chance of having a heart attack by 80%. I think it's so important that people really understand and take charge of their heart health because a lot of the risk factors are preventable ones.